Vitamin A, for acne. Vitamin A is a fundamental nutrient for skin health, and its derivatives, collectively known as retinoids, are among the most effective treatments for acne. While isotretinoin is a powerful oral prescription, other forms of vitamin A are available in both topical and supplement formats. How does it works? Vitamin A and its derivatives, retinoids, treat acne by targeting the 4 primary causes of breakouts: clogged pores, excess oil, bacteria, and inflammation. It has following mechanisms of action. Normalizes cell turnover. Retinoids accelerate the shedding of dead skin cells, known as exfoliation, and prevent them from clumping together. This prevents the formation of microcomedones, the initial blockages that lead to whiteheads and blackheads. Reduces sebum, oil, production. Certain forms of vitamin A, particularly oral isotretinoin, physically shrink the sebaceous, oil, glands. This dials back oil activity, leaving less fuels for acne to develop. Anti-inflammatory effects. Retinoids block inflammatory pathways and cytokines, like interleukin-6 and interleukin-12, that cause the redness, swelling, and pain associated with cystic or inflammatory acne. Inhibits acne bacteria by reducing oil and clearing clogged pores. Vitamin A creates an environment where Cutibacterium acnes, the bacteria responsible for breakouts, cannot thrive. Vitamin A also has some secondary benefits. Scar and mark reduction. By promoting rapid skin regeneration, vitamin A helps fade post-inflammatory hyperpigmentation, the red or brown marks left after a pimple, and can improve the texture of acne scars. Increased product efficacy. Topical retinoids unclog the skin surface, which allows other medicated treatments like benzoyl peroxide or antibiotics to penetrate deeper and work more effectively.